All right. Good afternoon, everyone. Today's September 5th, and it's 3 o'clock. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the CentralHealth Ad Hoc Succession Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. So the first item of business is public communication. Do we have any members of the public to speak? No. Okay. Then we'll move on to the first item of business, which is to approve the minutes of the CentralHealth Ad Hoc Succession Committee from June 26, 2023. So I think we have a motion from Manager Motwani. A second from Manager Bell. All in favor?
Aye.
Aye. Okay. The minutes are approved. So next we will receive and discuss a presentation on the President and CEO survey results. So we have Mr. Ted Burton presenting. Go ahead,
Hi, everybody.
Ted.
Good afternoon. My name is Ted Burton. I'm Chief Communications Officer. I have a brief update on the CEO search survey that we conducted over the course of 2 weeks in August. We can go to the next slide. Just as a reminder of the CEO search process, these are the activities and tools that we are and will be engaging in, and we are currently at the communications and community engagement portion, which leads me to the next slide and the actual survey. The objective of the survey was to give the community a voice in the search process regarding the most important values and qualifications needed in a new CEO. We used a Likert scale survey to capture and measure opinions, so 1 being not at all important, 5 being very important. We fielded the survey online. We made telephone calls with MAP members and in person at our recent community conversations. As I told you when we visited about this a couple of months ago, our participation goal was more than 200. And I wanted just to reiterate, this is not a scientifically representative sample of Travis County. It's a voluntary survey that we sent out, and people could take it if they chose to do so. The survey was fielded between August 14th and August 28th. So we completed 225 surveys. 217 in English, 8 in Spanish. This also included 7 surveys conducted by phone in the following languages, so 3 in Vietnamese, 2 in Spanish, 1 in Burmese, and 1 in English. And then the Vietnamese and Burmese interviews were inputted online in our online survey. So for a total of 225. Next slide. And so there were 9 questions, there were 10 questions, including an open-ended question. And I don't necessarily need to read through these, or I could. These are in your backup, but the questions that we asked people to respond to. And we asked them, please tell us how important the following attributes are to you on a scale of 1 to 5. Happy to go through these if you'd like, Chair Kitchen. Okay.
Just quickly go through them, yeah.
Sure. Mm-hmm. So the first question, and I wanted to also add that we developed these questions in alignment with our HR team and AMN consultants. So it was a combined effort, collaborative effort, I should say. So the first question: has worked as a CEO or other top level leadership role, has worked in a hospital or healthcare system that cared for uninsured patients of diverse racial and cultural backgrounds. Number 3, understands direct healthcare delivery and/or has experience in clinical care, including primary care and/or behavioral health. Question 4, understands the local issues that are important to Travis County residents. Question 5, is committed to ensuring that every person, no matter their skin color, place of birth, gender identity, and or sexual orientation or income level, can see a doctor and get quality care when they're sick. Question 6, has successfully led workplace teams with members from various backgrounds who share the goal of ensuring health care for all. Next slide. Question 7 understands the finances of complex organizations and knows how to manage large taxpayer-funded government budgets and explain healthcare, financial, and legal topics to various audiences. Question 8 understands and can connect with community members from different racial and cultural backgrounds, education, and income levels. Question 9 has experience working in a political environment, engaging with elected officials and community opinion leaders, and participating in public events. Question 10 has experience working with and reporting to a board of directors to plan for the future, manage sources, and achieve organizational goals. I also wanted to add that we worked with members of this committee to finalize and fine-tune the questionnaire. And then question 11 was an open-ended question. Are there any other attributes you think we should be looking for? Next slide. So we have more crosstabs that we can certainly share with you, but this slide just represents the average score for each question. The overall score was 4.32, and so you can just see from left to right the questions in order. The highest ranked or question that was most strongly preferred was the question 5. It was the strongest response. It's committing to ensuring that every person, no matter their skin color, place of birth, gender identity, and sexual orientation or income level, can see a doctor and get quality care when they're sick. The next slide is a word cloud. In your backup, you'll see all of the open-ended responses are captured there. But this is a word cloud that the survey tool that we use prepares for us. But essentially, it identifies either singular or plural words, tense variations, or other similar words and phrases, and then groups them together in this single word display. So you can see community, that word was used a lot, so therefore it pops and is largest on the screen. All of these words were mentioned at least one time, but you can see the ones that were mentioned the most. So healthcare, work, community, health, experience, leadership. So that just gives you a quick at-a-glance view of some of the responses that we saw the most. And then next, just how do we get the survey out, and how will we continue to communicate about this search? And we've shared this with you before. We did not use internal communications for this search because it was designed to be a community survey. But when we are communicating important work or initiatives, we always use our internal communications platform. So our internal newsletter, The Pulse, email, and then department and team meetings. Our website is a key communications tool for us. I should say our revamped website. Hope you have visited it and noticed some of the changes. But our newsroom featured content about the survey. Our owned social media channels, we push this out frequently on our social media channels from Facebook to Instagram. Through our affiliates and partners. So we sent this information to our partners and others in the community, stakeholders, influencers. At our community conversations, we promoted the survey. We also had a QR code on people's chairs so they could take the survey before, during, or after the community conversation. And then we did not do any direct mail, but we did do an email to approximately 7,000 of our constituents. So I think we promoted this far and wide, and the response outpaced what our expectation was, which was 200 completes. And with that, again, in the backup of your packet, there should be the open-ended responses. I can't read those to you. I think there was 124, but it does give you a flavor for what people said they were looking for in the next CEO.
All right, thank you very much.
Sure.
Any questions or comments from anyone? Manager Jones?
Just a quick question. On that first slide, you mentioned there were 217 English, and I think it says 8 Spanish. Embedded in that, does that imply that those who are 217 that were English also had those who are Latinx or of Hispanic origin as well?
It's English language. So it's the language that they chose to complete the survey, and we didn't ask for any
Identifying
any other
for
demographics.
Okay.
And it also just, because it was a little confusing to me as well, but it also includes the surveys that we conducted in Vietnamese and Burmese, but then we inputted it into the survey in English, because we didn't have a way to input that in those languages.
Okay, thanks.
Yep.
Other questions or comments? Manager Motwani?
I think it's fantastic that y'all nailed the over 200 completes, and the quickness with which that data came back to us, I think that's super helpful. As far as kind of following up on Manager Jones's question, the distribution of language responses is concerned, could you maybe share what might be, it seems to me that the number of Spanish respondents might be lower given our population served and their preference of language. Proportionally anyway. Is there any insight around that that might help inform that?
I just want to emphasize again that it doesn't mean that Spanish language recipients didn't take the survey. It just meant that the language of choice, and on the online survey gave them two choices. So they could either choose English or choose Spanish. And then, as I mentioned, with the over the phone, telephone surveys with MAP members. So I think it's a challenge to get the survey out there for people who don't speak, who English isn't their first language. So I think it's an ongoing challenge for us, and we're doing outreach and engagement. We really push hard when we want to reach people who speak a language other than English. So that's why, for example, we use the language line for the Vietnamese and Burmese. So we had our outreach workers doing the interviews using the language line. So I don't have any great insight. It's just to say that it is always a challenge. And we did send this out several times. We sent the prompt to take the survey out in Spanish. So our newsletter, hopefully you receive our newsletter. It's always in English and Spanish. So we really work hard to try to capture those responses.
I believe
and
that.
And I would love to see it higher as well.
And I know it's challenging. I think though, I wonder if there may be a way for us to just, ongoing continue to learn, which I know that y'all are doing when it comes to that process, but possibly, just given the, I think, percentage of constituency who is preferred Spanish speakers, I feel like we have 7 for sure who are Spanish first speakers, right? Because if I were choosing my language, I would choose the one that, I'd want to speak. And so is there any avenue, or is the door pretty much closed to getting more Spanish-speaking responses, or for example, maybe a targeted effort one day to have folks at point of care, where we have our CHW teams, and again, I'm pulling straws out of the sky just because I've been hearing a lot about our awesome CHW teams. Is the door closed for that? And I guess that may be a question for Ann as well, for Chair Kitchen as well as for Ted. I'm not sure.
From our perspective, we want to get started in the search, but that doesn't mean that we couldn't continue to get some feedback. The other thing to remember is we will, at the end of the day, not the end of the day, but towards the end of the process, we'll have community conversations. So we could also be sure that we make some extra efforts to make sure we have Spanish-speaking folks that are there at the community conversation. But I don't. Ted, we could continue to do some
the
feedback.
survey can be left open.
Yeah.
We don't have to close the survey. We wanted to
Yeah.
get a report to you. And the magic of the platform we use is for this is SurveyMonkey, so it makes pulling the results together is really pretty easy. I also want to, tomorrow you'll hear a report on our communications, or community outreach and community engagement activities, which will provide you with a comprehensive look at the entire year. And I think we can talk a lot more about the very deliberate and intense efforts that we go to try to capture people who do not speak English. And so you'll hear that in much greater detail in a report that we provide to you tomorrow during the Strategic Planning Committee meeting.
I super appreciate that. And I think, though, for me, it would be important for us to have an internal stretch goal, and I mean kind of a staff stretch goal. And I don't want to get into creating staff KPIs, but of 20 Spanish first surveys, at least 10% of maybe the 200 complete mark, because I don't think it. Well, first of all, it's certainly not. We could show up better. I know, given our constituency, and secondly, I don't think it honors. I think the efforts that Ted is speaking about to make our outreach team that much more multifaceted, and I think we could pull it together. But it's
Okay,
just a
so,
thought.
so what I'm hearing is that we could keep the survey open.
Sure.
That you all could make some additional efforts to reach out to Spanish-speaking folks, and with a goal of about 20, right? Is that what we're thinking?
That's my
Is that-
thought.
Can we do that, Ted? Can
I
we?
think it's doable, yes.
Okay, all right.
Thank you.
Thank you very much. That's a good point. Okay, any other questions or comments? Okay,
Okay,
Thank you very much.
Appreciate it.
okay, we're going to move on now to item number 3, which we're going to discuss a presentation of the proposed candidate prospectus for the president and CEO position. We can also take at the same time or flow right into item number 4, which is discuss the processes and timelines for the selection of the CentralHealth President and CEO. Members, I'm going to take these items as consensus items. In other words, getting everybody's feedback and then providing any changes or additions as part of that process. We don't actually need a vote to move it forward, so we're going to approach it that way. So we'll start with number 3. So Jeannie, do you want to start for us?
Yes, absolutely. Thank you. Jeannie Verdon, Enterprise Chief Human Resources Officer. As you all are aware, as we have proceeded through this search, we have engaged with AMN Leadership Solutions as our partner in this, and they have been leading the efforts to date to start the first phase of this process, which was the discovery phase. Through this, they met with key stakeholders, inclusive of you, the Board of Managers, Central Health executive teams, Central Health staff, as well as received the community survey results that led to them blending all of that feedback into what we're going to be presenting today, which is a candidate prospectus or a candidate summary of the skills and the qualifications that we would be looking for in the next CEO candidate. So with that, I'm actually going to invite Mick and his team up. We have someone joining online. I'm going to let him introduce himself as well as the team and talk through the process that they used and how they have developed the prospectus for your information.
Great, thank you so much, and I think I've met with everybody now. So, Mick Rule, Vice President of Executive Search with AMN Leadership
We could probably
Solutions.
take the prospectus down if we want to see Camille.
Yeah,
Okay,
there we go.
all right.
Very good. And I'll let Camille introduce if she's ready, and then I'll turn it over to Hisham, and then we'll get into the prospectus.
Hi, everyone. Thank you, Mick. I'm sorry I'm not able to be there today. I'm actually at another client site in Montana, but my name is Camille Briscoe. I'm a Vice President of Executive Search, partnering closely with Mick and Hisham on this search. And I can't see the faces in the room, but I imagine it's a large group of individuals that I was able to meet about a week and a half ago. So thank you for that time. It really helped us get very far into our initial phase 1 of our process here, and we're looking forward to continuing to engage with you and delivering the perfect person for your team. I'll turn it over to Hisham.
Thanks, Camille. Nice to see everyone again, and for those I haven't met last time, my name is Hisham Siddiqui. I'm with AMN. I'm an executive search consultant. I'll be spearheading the process, so to start off the process, most candidates will have to go through me before they go through the rest of the team, and so I'm excited to lead the process and get some good candidates your way. Thank you all for your time.
Excellent. Well, good. We have put together, I guess how we view the prospectus, it's really, we use it to share with candidates that we have in process. And we look at it as kind of a one-stop document, information about the organization, the community, the position, and then a little bit about us and contact information. So candidates have everything they need. It's kind of a beacon, I guess it's, keeps us in the lanes of what we're looking for in the search, right? So that's the purpose of it. It is not used as a marketing document, right? So we don't go to market with it. We may take portions of it to do that, to promote the position, but it's typically shared after a candidate is engaged in process and we're working with them. So just to understand that a little bit better, in its purpose. So we want to make sure, I guess, from this group that it reflects what we've heard, what we're looking for. A lot of this is your information, your own words. When it comes to the community feedback, the page that we've included in here includes the word cloud, and it also includes the questions you asked in the order of response, right? So the first was the strongest weight, if you will, from the community. I do want to give credit to the group too, that when you look at the response on the questions, if you had a scale of 1 to 5 and the average was all above 4, you asked good questions, right? So it all meant something to your community as they looked at it. So I would say kudos to that first, of getting the right skills involved in the questions for people to respond to that. We'll provide an overview. I assume people have had a chance to read through it. This is a draft copy. We would like any input, any suggestions, any additions, any deletions. So anything that you see would be important for us to tweak or change. Certainly this would be the time to do so.
Do you want to are you going to run through it briefly?
You want me to go through each and
Well, I
maybe
think,
each section?
I think you can explain what each section is and maybe hit a highlight or two. I don't think you need to read everything, but, you know, some folks probably have had a chance to read it, some may not. And also it's good for the public to hear just the highlights.
Perfect. And,
Okay.
Outlining it.
Mm-hmm.
The other thing I do want to mention is this is information that has been shared publicly or we've gotten
Mm-hmm.
publicly. So if there's anything that needs updating, sometimes it does, right? New locations, new facilities, direct reports, which we talked about to make sure that was consistent. So we start out with an overview of CentralHealth, who CentralHealth is, their locations, what makes up the organization, including Sendero, Community Care, and MAP. We then talk about the Board of Managers, how they're appointed from city and county. We get into the executive leadership, listing the executive leaders on there. We'll make sure that titles and everything are accurate. I believe they are. Locations and services are included next, including the new health centers that are coming soon. That takes kind of the overview of CentralHealth and who you serve. The next section, as we get into it, it's an overview of the position itself. Most of this was taken from position description that had already been created and shared. As you get through direct reports, qualifications, skill set, that was all given. When you get to the personal characteristics, this came from a lot of the intake, right? So this was an area that we heard your voice and shared that in the document. Not all inclusive, of course, but we felt it represented what we heard from all the key stakeholders. Board responsibility and requirements, when you look at as it relates to the CEO President role and the interaction with the Board of Managers. The next page, we have the one-page overview of what we heard from the community. So we took the survey results, we ranked them as weight in order from 1 to 10. To me, this was interesting. I thought a couple things that were interesting on here, that CEO experience was lowest on the list. I thought that was interesting, as well as political environment. The focus, when you look at it, is serving a diverse community and population. Love that. I think we heard that pretty clearly as we did our intake as well. And then we have information on Austin, Texas. That may be somewhat limited when you look at the information. You've got a large metropolitan area that we feel most people can gather information on in general, so.
All right, well, thank you. So we can have a conversation now, and for everybody here, this was sent to the entire board, and the entire board was invited to provide any feedback or input that they wanted to. So what our task is today is to see if anyone has any questions for our team here, and see if there's any comments, additions, anything that people would like to speak to about this document. So I'm going to open it up. Anyone have any comments or questions? Manager Motwani.
I don't want to be followed up by Manager Jones. I think this looks good, and I think it certainly is reflective of a lot of the input that we've been hearing, and certainly some of the input that I've shared. In reviewing it, I got the sense, and this isn't a critique of anyone's work, but maybe ourselves, maybe myself, was that perhaps we may have found euphemistic ways or just different ways of saying some of the things that are extremely important to us. And I think we nailed it for the most part, but I feel like we could say explicitly has experience and a track record of strong relationships with communities of color. I don't know if that's explicitly stated like that.
You want to say that again so that we can?
Hopefully it was recorded, but something to the effect of has a track record or proven experience of establishing strong relationships with communities of color.
Okay. So did y'all catch that? I think that'd be a good addition. Okay.
Thank you.
Okay. Okay, Manager Misata, if you want to go next.
Yes, hi, thank you. So following up on Manager Motwani, I would probably word it differently.
Okay.
Experience with underserved and vulnerable populations, that encompasses everyone, uninsured, and those of ethnic and minority groups. I think that's more inclusive. And that's, the literature uses that kind of terminology as well. So just wanted to share that piece.
I can appreciate that suggestion. I think on one note, I feel like the uninsured and vulnerable population is almost already enumerated. And the other note, I also feel like I'm not equating those populations in the same umbrella. Communities of color are communities of color. Vulnerable communities are vulnerable communities. There may be overlaps there. There may be overlaps with insurance, but my intent or the spirit was to specifically enumerate communities of color. But I'm open still to thoughts and ideas.
My suggestion was underserved and vulnerable populations, because those encompass communities of color and uninsured, etc. So that's just trying to distinguish, making it more broader, and that really takes into account the population that you are addressing as well.
Would it, Manager Minnesota, if we could just include all three words? You know, so perhaps we say with people of color, with people who are underserved, and vulnerable populations. Would that work for you? And Manager Motwani, would that work for you also?
I mean, again, to my earlier point, I think that's already in there.
Oh, you do?
I mean, I
Okay.
think it's largely, I mean, the first one is
Okay.
Opportunity and access to those who are underserved. Doesn't mention vulnerable. I do think that might show up. But I mean, to be very clear, I do understand Manager Musaitov's point.
Yeah.
I have a very distinct intent to want to say that specifically and almost own its own bullet point. So
Okay.
I'm curious as to anyone else's thoughts, if it's worth standing on in that way or not. That's all.
Okay, anybody have any comments or they want to make on this particular topic? Manager Jones?
Yeah, I concur with both of what they're saying. I do think it's important that we be inclusive, because there are communities of color that may not be underserved at this point in time, but because of what we're doing, we need to be able to reach out and let them know and provide services when they become in those populations. So I think all three would be a better way to do it as to single out just the underserved.
Okay, other comments?
I think I agree with Manager Matwani because it is not included in here. And I think that, having something specific that people of color can look to and feel like they were called out, that this person knows the issues and is going to fight for them too, I think that's good.
Okay. Any other comments? Manager Musadef?
I'm not sure if I read it or not. I think experience with working with low-income communities, that's really critical, and I'm not sure if I read it, that it's included.
Are you saying that, can you say that again? I couldn't quite hear you.
In terms of experience with working with low-income communities, that's really critical. And that is the population that we serve.
I think that what I'm hearing is a consensus to include that, but also to include a specific line about people of color.
Yes, I agree with that. I'm not
Okay.
questioning, but in addition, somewhere else, it could be a separate bullet that it experienced with working with low-income communities.
Okay. All right. I think we're on the same page then. Did you all catch that? Okay. All right. Other thoughts? Did you have anything else, Manager?
Regarding this?
No, just.
And I don't know if it relates to our charge here today, but in terms of, once we have this document ready and available, how do we go about distributing it globally in terms of outreach? I was just interested in that format.
Don't want to go ahead and speak to that?
Yeah, and maybe you want to talk about how the organization will use it, and we could talk about how we use it.
So we as the organization, this is what we will provide to anyone who would be willing or who would reach out to us directly that would be interested in the role. And then we would provide this document to them so that they would have an understanding of what the role is and what the skills and qualifications we would be looking for. And then we would actually refer them over to Mick and his team for further assessment and review. And that would be inclusive of internal candidates and external candidates that may reach out regarding their interest in this position. And then I will turn it to Mick so he can talk about how he will use it.
Okay.
And typically, as I said, we don't lead with this document. It's usually once we get a candidate engaged, and I think Hasham will tell you the first thing candidates ask for when he reaches out. So mind you, a lot of cases we're reaching out to candidates to get their interest. And so what's the first thing they...
The first thing they ask is for a full job description, the prospectus. And so that's essentially for us where the distribution comes into play. And so we're not marketing with this, to reiterate that. We're not going out and saying, here's a prospectus, are you interested? We are reaching out to targeted niche folks who will satisfy what you all are looking for in your next leader. And from there, after they review the prospectus, further gauge their interest. Are you truly interested? Does this truly line up with what you can bring to the table or what you're looking to do moving forward? And so, I don't know, do you want to expand on that, Nick?
Yeah, just we make it available to anybody that will request, but there's not a, it's not a open to publicly go get, right? So it's once we have them engaged. It will be through CentralHealth, but with us, we use it in context of communication.
So
with
it
candidates.
is posted as backup, for example, to this committee. So it is a public document that's available to the public.
Yeah, right.
Well, what I was trying to get at is that embedded in the definition, what we're looking for is an individual who has a great deal of experience in healthcare with a diverse background and the like. There are professional organizations, of course, that you're aware of around the nation, some with what we're looking for, particularly communities of color. And so I guess my question was, will we market to or develop, how will they get the information about this effort?
Yeah, and I'll start with that, then I'll let you talk about how specifically. So we will take components of this, so when we market, we'll take parts of this document. So maybe the position description more specific to the role and position itself, less about Austin Central Health, more focused on getting their attention and interest in the role. So it'll be probably focused on that piece first. We don't want to overwhelm with a multi-page document when we're just trying to get attention and get them engaged in conversation. And that could be in different forms, depending on where we post it. If it's a post, it could be less than a page of just highlights to get attention. If it's in an association where we're specifically going after associations, we may include a little bit more verbiage in there, page and a half of description to get interest that way. But
Yeah, and just to expand on what Mick said, you know, it's usually going to be 1 to 2 pages. It's not going to be too much. It's really just to grab their attention, and these will be posted to various vendors and venues that we have, and we have many that are very much focused on diversity. So if we do want to reach these folks specifically, when we do begin this outreach process, we will have a list of, you know, we have one avenue which expands the network almost to 200 plus venues, and many of these are diversity venues. And so Manager Jones, just to expand, once these people get that, from there we can provide the actual prospectus. We don't actually post it with the ad or with the posting.
Forgive me, I'm part of one of those national organizations. That's why I was trying to, so if I provided you with that information, that would be one you might want to provide it with, as well as others as well. Is that correct?
Yep.
For sure.
Okay then.
Yep.
All right, thank you.
And in our reach and part of the advantage of the size of our company, I'll start with, say that, is the ability to reach and get tentacles out into different markets, very specifically for that. And maybe I'll say this, there's three different avenues that we go to market, right? One is to post and try to draw attention. The second is to utilize our network and the folks that we've already have established relationships with in one way or the other. And the third is the three of us actually create a short list of people that we want to pick up the phone, go call, and talk to about the opportunity. So a lot of exposure going on at the same time. We don't rely on people finding it versus us going out and finding them and bringing attention to it.
Well, I just emphasize the American College of Healthcare Executives is of course, a great group, which subsets of that I would encourage it, because I do know that there have been efforts and are efforts underway to try and address it. And within those, there are subsets, the National Association of Health Services Executives and others. So those are the kind of groups that I would hope that you would penetrate to get the message out to those as well.
We do. And ACHE, I think they're limited to a very few amount of words. and again, it's just a caption just to get their attention to respond and engage in further conversation. But
we have and we'll post there.
Yeah. Oh yeah. That's a free site.
Mm-hmm. Yeah.
That one's always posted to.
Manager Motwani?
I know that at the end of the day, we can take the public listing and share it to whomever we want. However, Chair, is there a way, or is it prudent for members of this committee or the board at large to maybe send you any avenues of distribution that we may think, and then you may be able to liaise with the search firm,
we can do that.
and Jeannie? Okay, great, thanks.
Yeah, absolutely.
Strongly encourage that. We do that too, and a lot of. If Hisham reaches out, has a conversation with somebody, they may ask, we'll give you the prospectus if you want to share it with anybody you think of later, right? So we use it that way as well. Camille, I don't know if you had any additions?
Thank you. No, I was listening and following along with you, Mick, and I feel like you covered the points well that we leverage to be able to tap into diverse candidate markets.
Yeah, I would just ask y'all to speak a little bit more, because I know in various other conversations, but this is the first time we've had you here in front of the committee. If you all can speak to how you reach out and ensure that we have a diverse pool of candidates. Because as you're hearing and as you've seen from the community input, diversity is important in this community and to this board.
Yeah, and if you want to start of how you go to market, and then I'll talk kind of an overview of what we do as a team.
Sure. So spearheading the process, I have a very scrappy approach to this recruiting effort. So for me, it's going to start off with not only individual outreach. I will find folks specifically on LinkedIn, find their experience, and we'll reach out to them. But in addition to individual outreach, we'll also use our own network. As Mick said, we have a database of folks that we have gotten in touch with, either recruited in the past or worked with in the past. And so this is another avenue for us to take advantage of and either recruit folks or market the role some more from that. And so those are just a couple ways. And then in addition to the ad venues that we post to, when we do get folks coming in, there's going to be many folks who are not qualified for the role. It will be on me to vet them out specifically before they reach Camille and Mick, and before they begin the final vetting process.
How do you make sure that you're reaching out to a diverse pool of candidates?
We take a broad stroke to it, and over the years, and I go back to the majority of our placement come through network, where we already have established relationships. It's voluntary, so it's not a foolproof system, but it's voluntary EEO data that they share, right? Mm-hmm. So individuals could share that with us. Those can provide hints and obviously provide some insight as to who we're going after. It may be more about who we have relationships with as well. I know for me that's typically how it works. We do have specific training within our group that is focused on diversity recruiting. So there are, I'll call it tips, tricks of the trade, if you will, to identify and look for. But a lot of it could be either social or online information to provide to us to help with that. But a lot of it is dependent upon disclosure from candidates as well. But that's happened over the course of years and not necessarily this next conversation that we have. Camille, anything to add to that?
You're covering all the points, Mick. No, nothing. Nothing else to add. I was going to bring up the AIRS diversity recruiting that our team has participated in that you mentioned, but I think this is also a position that would be attractive to diverse candidates. So sometimes we're asked to focus on identifying a diverse candidate, but it may not be something that is a match. This does feel like a position that would, where there could be a match in that space as well. So I think that we are not going to have a difficult time being able to bring forward a diverse candidate panel.
Dr. Zamora?
Just one quick question. I mean, I know this is great for the candidates, but what are we doing about the partners? I mean, how are we going to convince those partners to want to come to Austin? Unless they lived in the caves, everybody should know about Austin and our great institutions with our higher learning, our great schools that we have here, our great homes. Are we going to tell them about Austin besides what you have in here already?
Yeah, so that would be what we may add to this, and I think of this online, is links that take them to school districts, Austin, city links. So we take advantage of that. Yeah.
Top high schools in the country.
Yeah. So when we share it electronically, we will usually have hot links in there that will take them directly to it. Kind of an easy button for them, right, to get there.
We were lucky enough to get Mike. Mike was in our backyard, but he had 3 young children. And then
Yeah.
we're going to come in with that children.
So the other, and again, this is, and maybe I'll share this anyway. We're a third party, so we're not hiring for the position. I get to maybe ask a lot of questions, and it's dependent on what candidates share with us, right? So again, voluntary information, but we're not shy about asking the questions. And one of them is if this involves relocation, who else is involved in that decision, right? So that gets the conversation started, and we talk about that. So when they're closed off on that, it raises red flags and concerns for us, right? So the more they divulge, the more they share, the more invested, the more engaged they are. Those are things that we're looking through the process. But it's not foolproof, but we put a lot of emphasis on that, especially if it involves relocation.
And I just would add, I don't want to speak to their process, but having, recruited executives, people who are looking to relocate, a lot of that does come through the conversation. and what is important. So someone looking for schools, then you would target your information for them specific around schools and what's important. So that's where a lot of these conversations with these candidates, that's where that becomes really important, to be able to truly attract and allay their fears so that they would be interested in moving forward with the process.
One other thing, and again, I'll go back, as we're a third-party recruiting firm, I do ask questions in general too. So not related to this position, you know, what are some of the motivators? What are some of the things you're interested in? And we're able to get them to open up and probably share more information. And again, it's in the context of we're trying to help you in your career as well. Let us know as much as we can to help you do that.
I'm going to circle back right now to the prospectus language, because I had one question and one comment about that. On the education and experience, the first bullet, goes through a list, and then the last bullet says any equivalent combination. What I didn't see on the list, and I would be thinking would be equivalent qualification, is clinical background. So, or even these degrees are not mentioned as clinical degrees, like a physician or someone like that. So I know that we're open to that. I know there's qualifications that could be equivalent to that, but I'm wondering if we should actually add that.
And I'll give my thoughts on that, right?
Okay.
So the MHA, public health, I think, is heading the right direction. I would caution if you say a preference for, let's say, an MDDO.
Well, I'm not saying a preference.
Okay,
I'm
all
saying listing it as,
Including it in there?
yeah. So it's clear that kind of degree might be considered equivalent.
Yeah, and that I like. If we include it in there, and this is my caution to it, some leaders that are not clinicians, if they see that, think you're looking for a clinician, somebody that has clinical experience. That's my only caution with that, is sometimes they get focused on they're looking for an MD, right?
Okay.
So, but I like putting that in there, saying, having that as an equivalent experience and education to what we're requiring.
Okay.
I'll have to think of how to incorporate that in, because I think that is a component that could be embraced for this role.
Okay. And then I just have a suggestion. I mean, this is a bit of a detail, but the third from the bottom bullet on page 8 says, if I'm looking at the right version, says able to navigate healthcare disparities in the community. Is that what I'm seeing? I would use a different term than navigate. I would use able to address or develop programs to address, something like that.
Okay.
Just so it is proactive and making it clear that what we're talking about is the skill set to help us address healthcare disparities. Does that make sense to you all? Okay.
Yeah, we can change that.
Okay.
Update the language.
Okay, I know we have the timeline, the process and timeline to go over. Let me just ask, does anybody else have any comments on the prospectus or questions about the prospectus? Go ahead.
I will say it's been a long time since I've seen a really useful word cloud, and I really appreciated that. So
Okay.
it was a good one.
Manager Musadev, did you have your hand up?
Well, I don't have a comment. I just want to appreciate you on this work, and thank you all. Just want to let you know that I have to step out for a meeting, and
Okay.
I'll be following up with you. And feel free to reach out to me as well. Thank you.
Thank you.
Thank you.
Okay, do you want to move on now to the process and timeline?
We do, yeah. I don't know if we've got that brought up or not. I know you have it in front of you, and I know I can speak to it. So there's a couple things that I really want to emphasize first and foremost on the front end, and I think I've perfect, okay, and I think I've spoken to each of you as members of the ad hoc committee. There's a couple of time commitments that I want to share, and I think this is important. I like to reemphasize. The biggest time commitment that we're going to ask for from this group is those first round interviews. And I'll give an example. We may bring forward, let's say, 8 candidates when we present candidates. We're going to ask you to interview 5 or 6 of those candidates in the first round. Those are up to 2-hour interviews, and we're talking 5 or 6. That's a 10 to 12-hour commitment from this group over a short period of time. So we'd like to put that over the course of 2 days, where you'd have 3 candidates one day, 2 the next, and then an hour of deliberation to discuss who you want to identify as your 3 finalists. So that's the biggest time commitment that I'm going to ask for this group. And when it shifts to finalist, then it's 1 hour at a time with each of the finalists as they come through, right? So that's less taxing than that first round for this group. The other time commitment will be the presentation of candidates, and that's probably going to be a 60 to 90 minute meeting, depending on the number of candidates. If it's up to 8, we probably are looking at a 60-minute meeting. If it's closer to 10 or more, then it could be up to 90 minutes to get through the information on candidates. And what that looks like on presentation is we'll bring forward, and I'm going to use just average numbers, right? So we'll bring forward 8 candidates. We'll give you a high-level overview. What you don't get from me is I don't rehash what you're going to see on a resume from experience and education. What you're going to get is maybe our interaction and what we're observing, what we see in them, what their motivations are. If they've shared personal information that they're comfortable with us sharing, we'll share it. So you can start to make more informed decisions on a candidate's interest and attainability. Those are things that I'll focus on. Resume and experience really kind of takes care of itself. And we can answer questions related to it, but I won't spend a lot of time on overview. So going through the timeline, we have already started our soft reach out, if you will, to the market. So we got kind of a short list that we are going and talking to. I've had a couple conversations that Sham has as well. Candidate identification in the next, it's really about 30 to 45 days where there's a big push in recruiting, which includes first round screenings, qualifying interviews. At 45 to 60 days, we're getting into more of the second round interviews where Camille and I are conducting those interviews more for fit rather than qualifications. And then as we get into really the 60 to 90 day window, that's when our candidate panel is starting to take shape. We're compiling information, preparing it for presentation, and we'll target. We don't have dates on that. We've got weeks, somewhat intentional on our part, just as milestones go. The other thing that we're conscientious about as we go through this is the holidays coming up. And this timeline is going to take us right into those. So we want to make sure we do certain things before Thanksgiving. We want to do certain things before Christmas. And all of this is dependent upon the market itself and who we're able to engage and get involved in process. We have some expectations, we make some assumptions, and especially in a CEO search like this, we have a pretty good idea of the kind of response we're going to get. To maybe put more context on that, we may talk to we may get response from over a couple hundred interested parties. We may talk to more than 50 of them on the initial screenings, and we may have as many as 25 or more on the second round screenings to bring forward 8 candidates at the end of the day. So a lot of work goes into it, a lot of funneling to get down to the 8 candidates that we would bring forward. Presentation, let's say it's 8 candidates. We're asking you to identify 5 or 6 for that first round. We'd like to see at least 10 days from presentation until those interviews take place. I've done it sooner. It puts compression on the travel arrangements for the candidates. That first round interview, I like it to be face-to-face. We would come back down, we'd facilitate those interviews, we'd be here with you while those are conducted. You get a lot more out of the face-to-face interview, so that would be my recommendation. Through COVID, we've learned to masterfully do more video interviews, so those can be done. I just think it works better for you as a search committee to see that candidate face-to-face. After the first rounds are completed, you'll hear me push towards 3 finalists. Not 2, 3. If you lose one to another opportunity and you have 2 finalists and you only have 1 left, you're not going to be happy with Mick, Camille, and Asham at that point, I guarantee it. So we will always push for 3. I've had situations where it was clearly 2 and they were going to be attainable, and we moved forward with 2 finalists and it's worked out. But I don't like to leave a lot of risk unnecessarily. So we'll ask you to identify 3 finalists to come back, as if all goes well in this timeline, we're hopefully in front of the holidays and we can do this before the end of the year. But again, it's dependent upon the market and the candidate response that we get. So I can't set that in stone until we're probably 60 days into it, and then we can probably get a better idea of where we're at.
And I'd also like to let everybody know that we're talking about potential dates for people to keep, to mark off. And Jeannie, I don't know if we all have reached out to the committees yet on that, but
I've provided the information to Brianna
Okay.
to start coordinating all of the calendars.
okay, so we're going to put placeholders on y'all's calendars. The other thing, of course, is that board members who are not on the committee are invited to participate if they want to. So please be aware of that, and we'll let them know of the timeline also. So everyone is welcome to participate. So, okay. And let's see, so questions or comments, anybody? Oh, the other thing I want to mention is you'll notice on there the community conversation with the finalist. The details about exactly how we will set that up will be a conversation that we need to have. We can have that at the next committee meeting or after that. We don't have the details around that. It's something that was done, I believe, at the last the last process that you all went through, and it's an important part of this process. So exactly how that looks is something that we need to figure out and get everybody's input on. So
Some thoughts on that and suggestions. Key stakeholders from the community, they can be one-on-one small groups. What works really well are social hours, to have a social hour where you have an open forum for kind of a meet and greet and allow people to come in.
Okay.
You could take care of a lot with just that. It's a little bit easier for the candidates as well. Puts them more in a social setting. I don't mind seeing them in that, especially a position like this. You want to see how they conduct themselves and handle themselves. So that's one suggestion, to do a social hour to invite the public in for a meet and greet.
okay. Questions or thoughts, anyone?
Any concerns on the time commitment? That's my big question for this group.
Well, they didn't run out of the room, so.
That's right.
No, I appreciate y'all moving with all due speed. I mean, obviously we want to get results, and we'll be prepared if it takes longer than the holidays, but that would be nice to be able to get it done. So.
Yeah, that's where the market kind of dictates, right? But we'll have to be honest with the kind of response and where we're at. If we're getting the results we're looking for, we typically do on CEO search, but if for any reason we have to push it back, I'll try to let you know sooner than later.
Okay.
That's right, right.
Okay. Okay, Chair Bell?
I do want to say, though, Brianna, sort of aiming at you, it's real important to get those dates on people's calendars.
Yeah.
Because, with the holidays coming up, people will be making arrangements to avoid airports, so they'll leave earlier than they normally do, because, it's such a hassle. So as soon as we can get some dates out there and some holes on calendars, that'll really make things better.
That's great.
I agree with Chair Bell. For me, I have 4 young partners and I have children, so they leave holidays. This guy's stuck in the office.
So, some suggestions on that too. Evenings, Saturdays. I've even done them on Saturdays, right? So
Okay.
we'll be flexible as a team here, but just keep that in mind.
So Brianna, maybe you can get that out, get that done this week and see if we can, okay. Did you have something?
I think that underscores the importance of having a really good hybrid environment. And though, of course, clearly we want to be as in person as possible, certainly the candidate and a few of us warm bodies want to be in the room. However, we need to have the expectation that given the season that we're moving into, there are going to be hybrid participants. So whatever we can do in-house to keep that as like sort of seamless and smooth as possible, knowing that we need to be nimble and there's going to be many of these, it'd be good to have that turnkey.
Okay.
One quick comment. It's important that we have the hybrid option because we're going into the flu season, the COVID season, and all of those issues. And so there needs to be an option where if someone is feeling sick, they can attend virtually and not come in and make everybody else here sick. So,
thank you, Doc.
Thank you. Okay. Anything else that you all want to cover?
I guess as I thought about this, as you were talking, if you make one interview, you make them all on that first round, right? So
Yeah.
we have
Yeah, that is
some
important.
consistency, right? We can provide you with a list of sample questions. We do like to see kind of consistent questions that are asked of each of the candidates as we go through process. It doesn't mean you can't ask questions of them specific to them, but at least have a consistency in the evaluation process as you ask same questions.
Yeah, and
Camille,
that,
anything else to add?
let me just underscore that for a minute also. It's because out of that first there's several decision points. One of them is who to interview. And the other one is who to take from first interviews to finalist. And so in order to really be able to participate in that, you need to participate in all the interviews.
Mm-hmm.
So that's going to be important. So, okay.
No, I echo that. It's just very important, as you both shared, Ann and Mick, for that consistency in the process from a compliance perspective, but also for really good, solid feedback from people that had an opportunity to engage with the candidates.
You'll hear us preach as we go through the integrity of the process, right? Just to make sure that when all's said and done, everything was done right and done well.
Okay. All right. I'm not seeing any other questions or comments. I'm going to move on to the last agenda item, which is to confirm the next regular Ad Hoc Succession
Chair?
Committee. Yes.
Before you move on, do you have, are you taking action on
No.
number 3 and 4?
No,
Okay.
what we've determined is that we have a consensus from this group that for them to move forward with the prospectus
Okay,
and with the timeline, and we're not going to vote on it.
fantastic. Thank you.
Okay. Okay, then the last is to confirm the next regular Ad Hoc Succession Committee meeting date, time, and location, which we don't currently have, but we will get that out to folks. Part of that is the conversation we just talked about, in terms of the timeline, and we may have a few other items to discuss, so we'll get that out to y'all as soon as possible. So, all right. I'm ready to take a motion to adjourn. No, wait, go ahead. Did you have something?
On the previous item, as far as the next meeting was concerned, you were
Yes.
mentioning items that may be discussed. Can I mention one, or is
Sure.
that? But I just wanted to make sure that we had a placeholder for the returns of the discussion when we ask all board members to contribute any possible avenues of distribution for the job descriptions. So
Yeah,
make sure that's kind of
that-
line itemed out.
Thank you for that reminder. We should get that sent out to the whole, I'm looking at Brianna and Jeannie. We should get that sent out right away, and give them a pretty quick turnaround on that, because we want to make sure that we share with these guys the avenues, and then we'll have a report back on what that was.
I'll work on messaging and
Okay.
Brianna to get that out by tomorrow morning.
Okay,
Thank you.
okay. All right. I'll take a motion to adjourn from Manager Brinson, a second from Manager Motwani. All in favor? Aye. Okay. All right, thanks, everybody.
Thank you.
Thank you all for being here with us in person.